Hi, everyone. Good morning, or good afternoon, or good evening, depending on wherever you are in the world today. My name is Ben Pine. I'm with the Skoll Foundation. And on behalf of the Skoll Foundation, I'd like to welcome you all to the very first virtual Skoll World Forum. I'm excited to join you all on this week event, and especially in today's session, using data for good in the fight against COVID-19, which is hosted by Public Democracy and the Atlantic Council. And as some of you know, the Skoll World Forum takes place each spring in Oxford, generally, in person with more than 1,200 leaders from around the world of social entrepreneurship, philanthropy, and social change. This year, we were, of course, forced to cancel the in-person forum due to the coronavirus. But our theme this year is collective strength. And we thought there was really no better way to reflect that theme than to have our global network design and build a Forum Week experience together. More than 80 organizations have contributed virtual events to this newly imagined inclusive forum that's taking place, including this one. So a big thank you to our host today. So to follow along, we're using the hashtag SkollGoesVirtual, and we'd love for you to do the same. And in addition to this event and many other dozens of independently hosted events that are taking place this week, we'd also love to have you join us tomorrow on April 2nd at 11 a.m. Eastern Time for the Skoll Awards broadcast, where we're going to reveal this year's Skoll Awardees for social entrepreneurship. You can tune into that at skoll.org/live. With that, I'd like to just extend a thank you and a welcome to our hosts at the Atlantic Council and Public Democracy, and hand it over to Dr. David Bray and Eric Sapp.
Okay. Well, and thank you, Ben, and for everything the Skoll Foundation's done this week and will continue to do, and to the Atlantic Council for co-hosting with us. My name is Eric Sapp. I'm the president of Public Democracy. We are a B Corp, a public benefit corporation that's been working for a while in the data for good space. We came into this space and came into the solutions we're applying to COVID-19 by starting in the area of building data around the core values that motivate people to come together and engage in the world. And we will all get, and we have an incredible group of experts here to talk about the COVID-19 solutions, but you will see that a lot of the reason many of us are here is because of where we've come from. And for us, the realizations that led to our PII-free modeling we're applying now to COVID started as we looked at our data and came to understand that the data we were building around values was much more than ones and zeros. It was much more than a better way to sell people. What we were collecting was a repository of moments of hope and intent and common purpose. And when we came to see data that way, it also allowed us to see the data creators in a different way, that the people building our data, the behavioral data we're all using as part of our world now, they're not users, they're not consumers, they're co-collaborators and creators. And through that, you see how data itself can become a source of crowdsourcing. The solutions people are finding through their behavior, through their own inquiry, is vitally important as we tackle some of the world's biggest issues. We're all now applying those in the area of COVID-19. Our particular path at Public Democracy that led to the foundation of this panel came from, we were originally brought in to recruit the initial class for the case against Monsanto over Roundup, where we had to move from PII-based modeling to identifying the behaviors and pathways in the data that allowed us to find the moments when people were showing that they both qualified for the case, but also were open to engage. We've worked with veterans with severe PTSD. We were working on opioids before we came to this moment. And then as COVID began to develop, we applied these tools that for us bring together offline data, that are used as filters for online commercial behavioral data and applied and reapplied through an iterative process of a human companion in the loop, that by March 13th, we were able to begin identifying hotspots and outbreaks of COVID-19 before the first test came back. We've identified different behavioral patterns that indicate whether people are symptomatic, their priorities on inquiry. These same tools are being applied to allow for, we were able to see that loss of smell was a key symptom of COVID-19 weeks before it started to come out in the medical world because of keyword associations, and seeing people that were showing they were symptomatic also engaging in that space. And so those are the tools we've been applying to this area, but we've done it through work with an incredible community. We have many of them on today, and some of the leaders are the Atlantic Council that turn over to Dr. David Bray in just a minute. But that I want to just emphasize that the experts we have on, they're some of the greatest minds in data, but they're also some of the best hearts. And I think through the course of today, we'll see why the groups that have been working in data for good and impact are precisely the ones, now that the world needs real solutions, who are bringing some of the best ones forward. So appreciate everyone joining us today, and for our panelists, and look forward to the conversation.
Oh, that's a very humbling introduction, Eric and Ben, and I'm excited to get to our panelists, because we do have some very exciting folks here. And I will sort of jump right in, because I feel like what we're trying to do is figure out how we can use data for good, how we are using it, as well as how we can going forward. And what I like, Eric, about what you said is it is about both thinking and thought, but also about bringing your heart. And I think you spoke about the values you're bringing with your data, because so often we talk about good, but you need to talk about the values you bring. And so with that, I'm honored to be introducing our panelists real quick. I'm going to actually go first to Jasmine. And Jasmine, if you could real quick introduce who you are and sort of highlight for us the efforts you are doing to actually apply data for good in the context that you're doing with your own organization. That would be great, please.
Sure. I'm Jasmine Hua, Head of Health Systems and Government Solutions at Datavant. Just by nature of the sector, you can definitely tell that we're knee deep in kind of COVID-19 efforts. We provide privacy preserving software that enables data to be linked, de-identified. I think we'll go into why that data connectivity is so important. So as Eric mentioned, the values are important. What we concentrate on are making sure that when data is connected, right now it's very siloed, lots of disadvantaged communities, homeless communities, advocacy groups, those tend to be left out of the equation. That's shaping up to be a really important signal in COVID-19 surveillance. And so we hope to support them in being able to link their data to health system data, because you've got outcomes, but it's too late by then, you're hospitalized. What we're looking for are signals from the community.
Excellent. And thank you, Jasmine. And now I'd like to also introduce Dr. Anthony Scriffignano from Dun & Bradstreet. And if you can introduce yourself real quick and also share with us, Anthony, when might data tell us when both responses are going well to COVID-19, as well as when we might actually start seeing how economic effects could be actually done to actually embrace or improve economies as a result of what's happened here?
Thank you very much, David. It's a very big question. So I'm Anthony Scriffignano. I'm the Chief Data Scientist at Dun & Bradstreet. And Dun & Bradstreet is involved on the commercial side. So we are looking at total risk, total opportunity, businesses all over the world, how they're connected with each other. If you think about the supply chains of the world, which is one of the first things that we started to talk about in response to COVID, if you want to get your supplies for fighting the fight, you obviously need to have a functioning supply chain. Think about the difficulty that the governors and the world leaders had in figuring out where is the critical industry, where are the critical dependencies, where are the things that move, not the economy from an investment standpoint, but the economy from a survival standpoint. If you think about businesses around the world, one of the things that we normally think about are the very large corporations, and we can rattle off 10 large corporations without even trying very hard. Almost all companies in the world are very small. So as we talk about helping people, and you talk about those marginalized others that Jasmine was talking about, think small business also. Excuse me, the fuel of recovery here will be the fuel of recovery of small businesses. How do they get back on their feet? How do they interact with one another? And then, of course, there are other concerns as organizations strive to provide investment funding and other support. How do you measure whether that's having the impact that you intended? So that the lifeblood, if you will, of recovery, when we move from response to recovery, will be around putting the resources in the places that have the most impact. To your question, David, Part of this is historically unprecedented. So if we claim that we can machine learn our way out of this, that we can just sort of push some kind of regression button and figure out the answer, that's naive. What we're doing is we're looking at how these businesses were. We have a catbird seat on how they were interacting with each other before all of this started. And you tend to think of the current crisis as something that happened in an instant. It really didn't. It's actually a wave that's moving around the world. So we can see some of that in the data. We can see some of the impact of recognition, response, and hopefully recovery. And so I think the salvation here in terms of providing that economy push will be understanding the impact of that and understanding the impact of the reaction to the actions that we take to recover.
Excellent. Thank you, Anthony. And now I'm going to turn to Rashad. If you could real quick introduce yourself. And then the question I have for you is, Anthony and Jasmine both have talked about certain applications, but if you could share, what are you seeing from your perspective about the different approaches people are doing, both to bringing together the data and making sense of it and then applying it? That would be great.
Yeah, for sure. And it's really nice to be talking to everybody in this format. I guess it's actually very, very, it's directly correlated to what I'm going to talk about for how LiveRamp is playing a role. So I lead our innovation and new business teams here at LiveRamp. And one of the things that we're seeing, which is sort of necessitated by sheltering in place, is that more and more people are interacting in digital formats, right? Instead of hanging out in person, we're hanging out in digital formats. We're doing this conference in a digital format. And so not only through the course of the current healthcare crisis that we have, are people starting to really accelerate in how much they're spending time in digital places, which then makes it such that the data is now actually present in digital formats. That sort of is an accelerant to what we were already starting to see anyways in the world, right? So LiveRamp is also what we call like a pipes business. So essentially, we help people connect disparate data sources in the offline and online worlds in a privacy-safe manner, much like how DataBand does it for the healthcare ecosystem. Traditionally, we've been doing it for the ad tech ecosystem. And so if you think about the amount of data that will now be generated in the online space, there has to be ways that we use it in a safe way, in a privacy-compliant way, that we can connect it and start to draw insights for how people are behaving and what people are doing in the online world. And so when it comes to the current healthcare crisis, this is definitely a place where we're highly engaged to help people interact through these online forums in order to reach them where they're currently spending the most amount of time, right? We're currently spending the most amount of time in digital formats, and LiveRamp helps people connect to consumers through these digital formats.
Excellent, and thank you for that. And now I'll turn to our fourth and definitely not least, but Dean, if you could bring it home for us, if you could both introduce yourself, and you're probably seeing from your perspective what international groups are probably asking questions of data and maybe how they're going about it. If you could share what you're seeing and what you think could be a force for good using this data, that would be great.
Okay, so I just want to offer context in the, next to these other speakers in terms of what I can actually bring. I'm not formally with the World Health Organization. I'm a volunteer, I'm an instigator with a physician and a former Googler. We approached the World Health Organization and talked about building an application for them because they really did not have either an Android or iOS app to bridge not so much the last mile, but the last arm length between the good they do and anyone with a mobile device. And so we've been working with them very closely, getting a sense of what it's like for responders that need to work at a global as well as a national or regional level. I think that I don't know if I have a brilliant answer here. I have some observations based on the humbling experience of seeing what the World Health Organization does from a novel point of view. When it comes from moving from response to recovery, I think it's not just when, but what. I don't know how we can tell that we've moved to recovery from response. Part of the context for us working with them is, there's this amazing Ebola problem a few years back, and it turns out that after all the money spent and all the energy that went into it, there were very few what I'll call digital assets to reuse or recycle for this crisis. And I know that after we move into recovery on this crisis, there will be another one after it. I think my second observation is that we're all talking about how to use data and how to respect privacy. And I just want to point out that the misinformation space hasn't gotten any simpler at all, whether it's accidental misinformation. And I think we can see this here in the United States in terms of guidance around use of masks outside of the medical profession or healthcare providers, or commercial misinformation with snake oil sales folks trying to sell snake oil, or actually malicious misinformation. That landscape has not gotten any better in the least. The last thing I want to point out in terms of data for good, which I think is a brilliant topic, is that in this transition, it's going to be very easy to have confused feelings, not just thoughts, around expertise. And I want to point out that there is a lot of subtlety that I think we're going to blow through very quickly. For example, I personally know the difference between a real estate lawyer and an estate lawyer in terms of who I go to depending on what problem I have. The difference between an epidemiologist and a statistician and an infectious diseases physician versus an infectious diseases person with a background in public health. These are all very different forms of expertise. And I think that being able to identify genuine expertise that's relevant and listen to that while tuning out noise is going to be a significant factor in really getting to data for good.
Excellent. Thank you, Dean. And so now we're going to go to sort of an interactive side, and it's going to be challenging because I know we've got a tight time frame. So I will just ask, if possible, keep your answers, if possible, to tweet size length. If I cut you off, it doesn't mean that I meant to cut you off. It's just I'm trying to make it interactive. And so the first question I'd actually like to ask all our panelists is, Dean mentioned how he's currently volunteering with the World Health Organization. Are there activities that you see where the public could actually play a role in volunteering to help either make sense of data, bring data? What could the public do if they want to help with data for good as well?
I think the most important, this is a lot like the medical engagement. One of the most important things you can do is not become a patient. One of the most important things you can do on the data front is not spread use the technical term from Carl Bergstrom over at University of Washington, BS. When you see something, take a moment to do a few web searches or check Snopes before you pass it on and avoid panic.
Excellent. Okay. And Jasmine, your thoughts?
Sure. So there are a couple interesting efforts, I think, in terms of things to volunteer for. There is the usdigitalresponse.org, where they are convening essentially citizens, anyone who wants to volunteer to kind of help in some way. What we're seeing is a wave of academic studies coming out to study behavioral patterns around movement and kind of tendencies. So UCSF, I believe this morning, released a study to get people to report movement and sentiments. So, those are things that affect all of us. And so as much as we can contribute as data generators, I think that will help when the data is needed to kind of piece together that fuller picture.
Excellent. Next.
Yeah, so one of the things that we are currently not faced with, but will be really important as we start to phase back into society, is contact tracing. And there's a lot of companies that are building systems to contact trace. So as an individual, something that you should start to think about very carefully is, how do I manage an understanding of where I have been and who I've been in contact with? We don't yet know what those systems will look like, but we know that it'll be really important that you know where you have been and who you have been in contact with. So that is for sure one of the things that as an individual you can think about with respect to data.
Terrific.
So I think I'm the late kid on the bus here. I would say three things. The first thing I would say is there are some obvious things that produce a trail of data that you should do. There's a census going on right now. There's medical testing going on right now. If you think you need to be tested, you need to be tested, or at least get evaluated for that. All of us sit in some way, in some space that touches data. So I'm reminded of the story of Stone Soup. The guys come to the village and everybody doesn't have enough to feed one more person. And then the guys go out and they start boiling water, and the villagers come and they add things to this stone soup and all of a sudden everybody has a wonderful meal. This is what we have to do. We have to figure out what we're going to bring to the table. No one of us can influence this by ourselves. If we don't collaborate, then we will surely make this worse. We have to collaborate.
Wow, Anthony, you just set it up great for the next question. You didn't even know what it was, but that's perfect because the next question I want to ask, and we'll go in reverse order this time. So Anthony, you get to go first. The question I'm going to ask now is, so here at the Atlantic Council Geotech Center, we're looking at how new technologies and data impact the world, change societies, change geopolitics. So what do you all see could be a force for good that does require possibly working across sectors or working across countries regarding data that we can do here now to help make sure COVID-19 is not as bad as it could be?
I think the first thing we have to do is be very careful about the definition of good. So the different constituencies in an ecosystem will always want slightly different things. And very often, I use the analogy of pushing a rock up a hill. We're all pushing the rock up the hill, but we're kind of pushing from different directions. And so most of the effort goes opposing somebody else, not intentionally, just accidentally. So the very first thing I would say is definition, definition, definition. If we say we're using data for good, let's not just get too altruistic about that. Let's define what that means. If it's to help more of the goods and services that need to help the hospitals and healthcare providers get to the health, then that's a great good. If it's to help businesses recover, then that's a great good. We have to define the good that we're going towards. If we don't agree on that good, let's get to an agreement before we waste a lot of that effort pushing the rock up the hill. And then once we agree on these definitions of good, and there probably won't be one. There'll probably be, if experience teaches us anything, somewhere in the low teens of, focal points, right? Then we're going to have, there's going to be this vetting process because, there's an old saying that when you set out to, be careful when you set out to flood a desert, you may succeed by draining an ocean, right? So you'll do something that is good in one way and then suboptimal in another way. So we've got to keep our eye on the big picture and not our own little tiny parochial version of good. Otherwise, we will waste a lot of effort here.
Excellent. And Rashad, if you could share your insights.
Yeah, I just want to echo what Anthony said. I think it's really important to have some sort of agreement on what good is. I think one specific way in which we need to think about it pretty carefully is with respect to people's privacy, right? As we're using data, and especially when we're using data for good, one of the trade-offs that you have to be really mindful of is privacy. So I think that amongst the technologies that we will see very useful consumer first or citizen first privacy technologies that we need to be on top of and ahead of in order to make sure that individuals, when they are engaging with this process, have a reasonable understanding of how that data is being used and why it's good in whatever definition we agree on is good.
Excellent. And Jasmine, your thoughts?
I'm pretty concerned about, I think, the digital divide because right now, data is how we measure, but there are whole constituencies that are just left out that are not being measured. And so we're getting information to proxy. And to Rashad's point, most of these communities are not well informed or no one has taken time to help them understand privacy. It's almost like, well, if you're disadvantaged, you don't get to choose. We will serve as your proxies and report for you. I think that's a really dangerous stance to take, to assume an advocate understands the situation and lives of these other people. So that's definitely from a data collection perspective, as we start making inferences, something to consider as we think about like what good means.
Thank you. That's great. And Dean, if you could bring it home for us.
Yeah, I think I'm echoing this. There's going to be a sequence of goods that will come back online. And it's going to be very easy for individuals to be parochial and selfish and expect that what's good for them will come online first. And managing that sequence is going to require a very different mindset because I think we're very used to a marketplace where sharp elbows move you ahead. And I think this is a very different world now.
Excellent. Okay, so we still have, I think, about 2.5 minutes left. So we're going to have to make this really short. I'm going to go in the order of Jasmine, then Rashad, and then Anthony, and then Dean, you get to be the final. Or actually, Dean, you go, and then Anthony, you bring it home at the end. Sorry for that. The question I have is, we've all talked about how we can make sure we recognize there's going to be multiple definitions of good. We talked about what people can do. We also talked about, and Dean mentioned about expertise. And it's worth noting that expertise and experiments both have the word experia. It's Greek for out of danger. The only way we learn things and we gain expertise is we do dangerous things, experiments. So in a real quick tweet format, starting with Jasmine, if you had to do an experiment, or if you had to wave your magic wand and you could actually be queen or king for the day, what would you actually have world leaders do to help uplift both the response and the recovery from COVID-19?
That's a tall order, but I think something we all have to tackle right now in that spirit. So, we're so much centered on data, and I can't emphasize enough how much data sharing is really important at this point. This is a reason why it's a pandemic. It's a global problem. And right now, what we're seeing is silos. On my side, in terms of health systems, we're seeing a lot of people trying to share best practices, but that's happening ad hoc. We need a clearinghouse. We need a better way to navigate this information so it's not shared in kind of little silos and circles just because we know each other.
Excellent. Rishad, your view?
Yeah, I think if I could run one experiment as the leader, I would probably try to understand which is the safest cohort to put back into running the economy. So at least to me, the recovery is just as important as what we're facing right now. And if I could run one, it's really finding those individuals that we feel confident can help the rest of the economy and lead the way for everybody else.
Really great point. Thank you. That was great. Now, Dean, and then finally, Anthony.
I would remind leaders that disease doesn't care about national or regional boundaries, and I would ask them to please act that way. So perhaps the experiment would be to act as a team instead of a set of rivals competing for fixed goods.
Yes, excellent. That's a really important point. And then finally, Anthony.
So you said one experiment, but you didn't rule out mixed methods. So I'm going to require 3 things as an outcome. We want to demonstrably and repeatedly effectuate 3 things. The first is collaboration. We have to work collaboratively for all the reasons we talked about. The second is transparency. When we try to hide or massage the information, we create bias. Bias in times of uncertainty drives multiple types of misunderstanding, wrong steps in the wrong directions. You set out on a journey, you're 5 degrees off. By the time you go 1,000 miles, you're pretty far off. So transparency and collaboration. And the final thing, to echo the point that was just made, is that some small portion of our resources have to be focused on the assumption that we emerge from this. And how are we going to come out of this running out of it, not falling out of it? So what are the steps that we do as we're recovering to make sure that we do that in a stable way that brings us to a better place?
Excellent. So I want to thank all the panelists. I think you're probably hearing a sound of applause from social media at the moment. And with that, I will now turn it over to Eric. Eric, if you can take us now into panel number 2, that would be great. Thank you, panelists.
Thank you. Yep, and excited for the second set. So, you all just heard we started with this context of hearing from the people that are creating the environment that we use this data in, or building the systems that work. And now we have the joy of hearing from a group of people who are applying it, who are a lot of the doers. I'm reminded a lot of us to become familiar with Mr. Rogers' quotes. When things get scary, look for the helpers. The group that I have on our panel are a lot of those helpers. We have Liz with the Ad Council, Cory with Splunk, and Daniel, who's part of that incredible initiative with World Health Organization. So everyone's bio is on the websites. I'll let people look up and dig deeper into the tools on their own time. I want to just jump into this conversation and go to Cory first, because just the group we have Splunk, that's been a leader in visualizing data, Ad Council and communicating it, the work Daniel's doing and bringing it to the individual level, making it real. One of the first steps in any data is making it understandable. And what Splunk's been doing with visualization has been really showing leadership in that way and helping to democratize data. So Cory, could you start us off by just kind of talking through some of your specific applications, and I think you've got some examples to show as well for how you all are visualizing data.
Certainly. Thank you. Thank you very much, Eric. And glad to be here today, albeit virtually and a little bit disconnected at that. So my name is Cory Marshall. I am the head of social impact for Splunk, and Splunk is a global big data cybersecurity firm. What we're doing here in the COVID epidemic is really trying to find ways to raise the visibility and awareness of the data that is out there, as well as trying to understand a little bit better how we can bring some of that data to bear for those that are working on the front lines. So where we started this whole conversation, I'm going to share my screen here. Where we started this whole conversation is trying to find ways where we could bring value to this via the product that we have. And so what we did is we created a series of different types of visualizations, and I'm trying to get to them, but that allows us to really bring some context to the things that are happening in the world right now. And so we started out by just giving a 30,000 foot view, and this is no different from a lot of the data that folks are seeing from places like Johns Hopkins, World Health Organization, and the like. But what we're trying to do here is bring a little bit of additional context here. So what you might see is that there are some event annotations and other things that help to explain not just what the curve of infection rates are, but also where you're starting to see different types of behavior and how some of these different events correlate with that. Additionally, we're trying to dig in a little bit more deeply and try to create some tools that are directly relevant to first responders and public health officials on the ground. And so what we've done is taken a sampling of different hotspots, and these are US-centric, but again, this is our opening salvo, so we'll be working on different regions throughout the world as well, where we can start to identify where some of these different areas are that require additional attention, as well as some of the different demographic data that comes along with this. And these are all data sources that are available freely and publicly. But the difference here is that we're trying to present them all in one unified view so that folks can understand exactly what's happening here. And so this is just one example of the ways that Splunk is trying to weigh in the current crisis. And as you can imagine, these types of assets trigger all kinds of interest from officials at all different levels of government. What we're also doing is participating in various coalitions, including one of a whole bunch of different cities and states in the United States, where we're developing solutions in concert with other companies such as Accenture, Adobe, Oracle, and a number of others, so that we can start to automate the intake and evaluation and testing process. So basically, we've identified tools that allow you to help self-identify what symptoms you're experiencing, identify if you qualify for testing in your area, direct you to a local testing location, schedule for that testing location, and then report out the results. And we've worked with these companies, and what we've noticed is that there is a new sense of urgency and alignment among a lot of these different types of partnerships that we have not seen in the past. And when I say that, you wouldn't typically associate any of the names that I just put on the table as moving quickly or in an agile fashion. And yet we went from concept to MVP, minimum viable product, in just over a week. And so we're in the process now of having discussions with a number of government leaders to see how they can deploy some of those solutions in their jurisdictions.
Oh, thank you. And I think that that focus on collaboration is a key as we look to solutions. And Liz has built a career on collaborating with people, but also figuring out a way to communicate needs and educate. And so, can you just take a minute to talk through what Ad Council's been doing, and specifically how you all have been refining different messages for the different groups and these different points of need?
Absolutely. So we have been working in conjunction with the administration, the CDC, and the HHS, as well as our entire suite of media partners and advertising industry partners to help produce these messages. So the foremost message that we developed was in conjunction with NBCU, really targeting those high-risk audiences. So we needed to develop a message who could reach the 65 plus and those with underlying medical conditions. And 2.5 weeks ago, as well as now, it was so important for us to be able to have that data to not only reach this audience, but ensure that they are seeing our message, that they're seeing it across every available channel, and that they're being driven to a place where they can go and understand what actions need to be taken. We've also developed messages for the younger audience, the 16 to 35. As everyone knows, recently, encouraging them to stay home has not been incredibly easy. So we've been really lucky to partner with Viacom on our Alone Together work. And so we're doing our best to get that message out and into these hands and encouraging everyone to stay home, practice social distancing. We're also looking to develop work to target parents, specifically those with young kids. Everyone right now is trying to balance that homeschool and work from home at the same time. And so we want to make sure that we're getting these assets into the hands of the parents to let them know, there's resources out there. Here's things that you can do, as well as encourage safe hygiene and pass that along to the children. And then we're also looking to develop some mental health work. It is not an easy time right now. This is not something any one of us have faced in our lifetime. And so we want to make sure that everyone has those resources depending on where they are in the stages, or if they fall into multiple buckets. I think everyone could use a mental health message right about now.
Yep. Thank you, Liz. And as you all will hear, we're kind of moving through this progression of how do you make the data accessible to people to then create these messages folks can relate to. And Daniel's been working on an incredible solution to really bring it down to the personal and local level, which is what data done right can do to have some of the greatest impact. So, Daniel, can you just share some of the Waze program you're building for COVID-19 and how you expect that to be utilized?
Sure. Thanks for having me. Great to be here. I'll cover that in a second. Just a couple high-level thoughts is that, part of the opportunity is to bring lots of data together and use that in empowering ways. I'm helping lead up a new task force, part of this Enterprise Pandemic Alliance, which you can check out through the URL there. But it's hopefully going to allow everybody to contribute their data. And lots of folks have a sandbox to play into to solve solutions. Just some really interesting elements. We all know about staying home and saving lives, but now we can start to see the data as well. Where people are not moving, like in California versus other parts of the country. And it seems to be working here in San Francisco. This is data out from just yesterday that we're starting to flatten the curve and turn the right direction, at least in the San Francisco Bay Area. So the data is bearing out in that regard. Part of the challenge and opportunity here was all these new exponential data sets, whether it's epidemiologic, public health, viral genomics, et cetera. The challenge is how do we narrow all the data, turn that into information, and bring that to clinical utility to each of us where we are, or to the CDC, WHO, or beyond. So I think that's one of the high-level opportunities and challenges here. So the future may be that we really get just-in-time information about who to shake hands with or not when we get back to shaking hands. To the sort of project we're working on with the WHO, literally almost only 3 or 4 weeks ago, I met the WHO Global Ambassador for strategy and pitched them this idea. We all need not just COVID-related information, but have information that's personalized to you, your age, your language, your exact location. So I kind of codenamed this the Waze for COVID. And we rapidly got that greenlit up the chain, and with Dina Kamovich and Bruno Bowden and a group now of tech Avenger team. We have over 2,000 volunteers building literally a Waze for COVID-19 that the Tedros even sort of announced last week. We're hoping to launch it on Friday of this week, where people will have, again, very relevant hyper local information, but just like Waze, data can go back and inform the map all around us. And we've seen examples. Korea's done versions that have been quite effective. There's a lot of sensitivities around contact tracing and who owns that data. We're not going to start with that, just basically localized relevant information. There's already examples of crowdsourcing this that everyone there can contribute in out of Harvard, COVID Near You, where you can share how are you doing. If you're not doing well, what are your symptoms? Have you been tested? And create those sort of maps that are localized to you. So lots of examples, and we see hopefully the WHO platform to be one where we can pull these solutions together into one sort of platform that can not just help with this pandemic, but global health going forward. And lots of examples of crowdsourcing data from your thermometer all the way to eventually your Fitbit to track who and where is getting sick. And now you can all crowdsource your data. There's a new platform called the My Data Helps study out of Scripps, where we can start to, again, share information and understand this disease and others. So that's my short summary.
Thank you. And just for Liz and Cory, this is all highlighted, and all of us on this panel have been working together. The new collaborations, and I know kind of Splunk and Ad Council have depended on those in the past. But what specifically are you seeing in this moment? And then, what kind of lessons do you think we're taking for moving forward beyond it, where the crisis is forcing new ways to collaborate, share information, and combine resources?
Absolutely. I'm happy to start. I mean, we have seen so much support from our industry. It's really, I mean, we just have people knocking on our door wanting to help distribute these assets, which is fantastic. For the first time, and this is going to get a little media specific, we are actually launching a donated media private marketplace. So rather than all of the individual publishers supporting the creative on their own sites, we're having those publishers donate this media to us through one source, which we're able to activate through the trade desk. And that way we're able to take full control of this media. So we're able to take donated audience segments, identifying those with high risk, those with underlying medical conditions, which ones are parents, which ones are most likely at risk or in need of a mental health message. And so we're able to best target those ads to the exact person who we're trying to reach. And we can then control for things like reach and frequency. We can make better optimizations of who's going to the site, who's engaging with additional content, as well as look at, all of the other data that's out there. Should we be focusing our message into more specific geos? Should we change up our message in specific locations? So really taking all of that data available and applying it to the messages that we're distributing.
Yeah, and what I'll add on to that is I think what we're seeing that's driving a lot of this interest and engagement is really just this new sense of urgency and alignment of resources. And I'm noticing this both inside of our company, where, traditionally what we do is we try to leverage resources from across the organization in support of a lot of the partners that we have. But now what we're seeing is we are more the tip of the spear when it comes to trying to engage some of these different partners, developing solutions, trying to find ways to engage our full ecosystem of resources. So whether that's directly through our professional services organization, through a lot of our partners and integrators, through some of our customers. I mean, the city's initiative that we're plugged into is actually the perfect embodiment of that, because what we're seeing is the leveraging of these industrial grade tools to move quickly and be adapted quickly so that we can apply them to this urgent need that we're all experiencing and facing right now.
Thank you. And so, Daniel, Jasmine in the last panel had mentioned something that really resonated with me on again, going back to some of these holes in the data and the differences that come from where there is good data and some of the socioeconomic and other justice pieces of it. We talked earlier, one of the implications of that is in this question of privacy, as privacy is much more of a concern of those with privilege, that that you build the gates around the wealthy communities, and in certain societies and other areas, it's not as big of a core value as other communal ones. As you all are looking at this tool, and you'd mentioned the tracking aspects, what are the questions? There aren't black and whites on this. So what are the questions that you all are starting to explore, that you've explored with WHO? How do we utilize these and balance these different values and priorities? And what are the best practices you've seen in your process?
Well, I'm not a privacy expert, but I'll just sort of zoom back from the sort of usual clinical perspective. And as a physician, I've often been very frustrated by well-meaning rules like Hipaa, Health Information Portability Act from 1998, which was arguably written in the pre-digital era. And that in some cases has been a well-meaning but hindrance to sharing of data. The patient died with their privacy intact. I think most people would rather survive even if their privacy was a little bit foisted. And here we're almost like in a wartime situation. And I think some rules need to bend, at least temporarily. In terms of the WHO, we're not entering any sort of, it's all very anonymized information based just on location. We're not getting into any quote unquote contact tracing with this app. And again, I'm not speaking for the WHO specifically, but I would just say we need to be very careful, but also how do we leverage that in smart ways? The real application is not where we're in, like in New York with mitigation, where there's a huge number of cases, but the classic epidemiology of finding an individual who's the early case, seeing who they've been around, isolating them, and being, again, very proactive with those early cases. That's where sort of contact tracing can play a role. And there are parts of the world where there's not yet been a lot of spread, and we have the potential to be preventative rather than reactive. So I think it's a really challenging topic, and we need to be mindful about it. But how do we use it for the best public good rather than privacy trumps all?
Thank you. And we're coming towards the end of our time on the panel. So I just wanted to give everybody a chance. I know, we've got quick list through the RSVPs. We got an incredible audience and people that are also the helpers out in society, foundations, the media, other NGOs and government leaders. For all of us working in this space trying to do, I wanted to ask each of you all, what do you most need? And I'll start like at Public Democracy. A lot of us need funding to take these new ideas to scale. Like for us, just even our work with Splunk, creating a way to do this data feed so it can be visualized in those maps, and using the tools to speak to people in the moments requires outgoing funding. And I know that'll be something that Liz talks about. But those are some of ours that we'd encourage people on. I want to just start, Liz, I'll start with you again. And then if everyone could just share, what do you most need, and what do you think the broader effort most needs from the audience that's on today?
Absolutely. I would say, particularly if you are in the media or the data space and you think you have something that is of value, to please reach out to us. We are so eager to be able to reach these audiences and expand our reach. And for the first time ever, this is not just at a US level. We are partnering with people who are distributing these assets globally. If you know how to translate languages for different creative, we are looking for everything. This entire campaign that we're running so far is pro bono, and it looks like it will continue to be that way. So we are looking for all kinds of volunteers.
Thank you. Cory?
So, there are a lot of things that we need. Obviously, I think one of the biggest things that we can do is start to actively advocate for the availability of some of this data, and not just in a temporary situation. To Daniel's point, one of the biggest well-meaning restrictions that we have in front of us is our regulations like Hipaa that are privacy focused, but actually hinder clinical outcomes in many, many regards. And so we need to try to find ways outside of just emergencies for us to be able to leverage some of the tools and the data that we have to improve clinical outcomes, so that when we get in these situations, we're not left without the tools that we need to be able to do those things quickly. And there are lots of public decrees right now coming from governors and other levels of government to relax certain provisions of those. But I think that there's a longer tail that needs to be pursued, both from an advocacy standpoint, but as well as from an investment standpoint, to make sure that those tools are developed in a responsible way downstream. The last thing that I'll say is, there are a lot of funders and others that are active in the funding community on this call. I think what we really need is to try to find ways to collectively put our wood behind a finite number of arrows so that we can actually be effective in implementing these solutions. This is going to be moving with a fierce urgency into the global south. And so I think there's going to be a need to expand on the lessons that we've learned in developed countries in the coming months, so that we can make sure that we have the infrastructure in place to protect those that are going to be much more at risk in the coming months.
Yep. And then Daniel?
I'd say, riff off of that, back to the sort of, Waze analogy. We couldn't imagine driving with paper maps anymore. We all share data when we drive, and when we used to drive, see the maps, and on Waze you share what the traffic stops are and the accidents, et cetera. And if we can all think of ourselves as not just as, blood donors or organ donors, but as data donors, and kind of build that collective map and collate our data and silo it, I think that's going to catalyze things. I mentioned that XPRIZE Pandemic Alliance. One of the things that would be great if people go to COVID-19.xprize.org and see a way to donate their data when appropriate. And then if you are a data scientist or others can start to learn from that, that would be helpful. I think it's been instructive to see just in the last 2 weeks since we sort of started this WHO COVID App Collective, how many folks are coming together from around the world to solve very nimbly. And that will hopefully be an example of how folks are going to collaborate data and solutions and technologies as we move into the post-COVID era, which will arguably look quite different across many industries, especially healthcare and public health.
Thank you, and thanks again to everyone on this panel. I'd encourage all of our audience, go to the websites, learn about all the incredible work that the folks we've just been hearing from and the first panel have been doing, and we've got a lot of questions. We've got more than we'll be able to get through, but our hope with this was to seed a conversation. So we'll also use this as a way to do individual follow-ups and one-on-ones. But to jump into those questions, I'll turn the baton back to David Bray.
All right, well, thank you, Eric. Glad to be back, and really appreciate that second panel. It was very pragmatic, and it was focused on what is being done both now, and excited to hear also about what's going to be released ideally on Friday with what Daniel and Dean and everybody else is doing, and honored to be a part of these efforts moving forward. So we're now at the part where we're actually open to questions from the audience. So if you have questions, please type them. Obviously, we won't have enough time, as Eric said, to get through them all. However, we hope with everybody here and with Skoll and with Public Democracy that we can actually do additional discussions on this important topic. And I'm going to ask for the panelists if you could either A, type your name if you want to answer the question, or B, try to flag me down in the video, just because we're probably not going to be doing all of you for each of the questions, but if you have an answer, that would be great. And one of the questions that I saw that was already asked was what could be done for the global South. And so we're thinking about Africa, we're thinking about South America, we're thinking about Southeast Asia. What could be lessons that the global South could start thinking about from what we're thinking about both in the immediate and the long term regarding data? Does anyone want to jump on that one? Well, Anthony's jumping. Go ahead, Anthony.
Okay, so I'll take one for the team here. You're talking about a lot of countries that don't necessarily have it in their behavior to just collect and share data. And I'm not trying to categorize because I realize the South is not a country, right? So there's some increasing development and really sophisticated development in some parts of the global South and in others, not so much. I think that it's very important for leaders in those areas that don't necessarily have the infrastructure to share information or the habit of collecting it to start looking at what can they collect to understand the baseline. Because if you don't understand the baseline, then you're going to have a really hard time understanding the disruption. You know the storm is coming. So this is a really good time to start focusing on that baseline.
Yeah. Excellent.
And this, Eric, just to add to that, I think recognizing the relative strengths in some of those communities, they've jumped the first world oftentimes in their mobile adoption. And I think an opportunity here is a lot of us in the North are being affected first in thinking about how the solutions we're finding do apply elsewhere and trying to build tools that are scalable and can work to help those that are often the ones that are left behind and the least, both in our own communities, the rural parts of our country, and in other countries. So an opportunity for a shift in thinking is it's in the everyone acting out of self-interest can also support the common good. And because of how this is spreading, some of the biggest beneficiaries can be in the global South. And so making sure we're building tools that scale and are usable in that way.
All right. And I'm going to now jump to the next question that came in. And again, we're going to try and do this in tweet size, or, if you can do the extended tweet of 240 characters, but, try to do tweet size. The question we have is, what can a network of open source and open data developers do to engage? Do people have thoughts about how those groups can engage in different efforts? Dean, do you maybe want to share? Because I know you're trying to pull together at least with one effort, and you don't have to necessarily speak for that specific effort, but I know you're trying to work across those different groups.
I'm going to actually defer to Daniel on this one.
Okay.
Yeah, I work on the same project. I'd rather have the doctor speak.
All right.
Well, I mean, just the thing that's been remarkable to me is how many folks came together through, the Dean and Bruno Daniel network is now spread to 2,000 plus volunteers. And in a week, we basically built an app that's approved in the App Store and ready to launch. It won't be perfect yet. I mean, it's going to be a V1 that can be, again, a platform for hopefully integrating and sharing data out to less resourced communities. I mean, a big footprint for WHO is parts of the world with low bandwidth, so it's built for that opportunity. But then also to hopefully bring the right information in to inform the WHO and public health authorities so we can respond smarter now and in the future. And then hopefully that, given that it used to be that non-infectious diseases were becoming much more common, that sort of platform can be a public health utility for many downstream applications once we're past this crisis. But it is, again, encouraging to see many folks come in and enter the sandbox.
Excellent. All right, I actually have a question now, and this is for Liz. There's someone that has asked about, so if we're thinking about what would be recommendations for the media or for those that are associated with ads, what can they do to be of assistance and make sure that the right information is getting out and that we're not, we talked earlier about the challenges of misinformation or disinformation. So I wonder, if Liz, if you had any guidance there.
I do. So we actually have a toolkit that we can share out after. It's coronavirus.adcouncilkit.org. And so all of our messaging is available on there. All of this messaging has been developed in tandem with the CDC, with the administration, with the HHS. And so we are driving to coronavirus.org. That is based in the US. There is another organization who is working with WHO to help spread this message globally. But in terms of media, we would say, visit that toolkit, whatever assets you are able to run. We really encourage you to download from there and spread those messages. If there's something you want to develop on your own, you can definitely reach out. But I think, spreading these messages as far and wide as possible is really the key goal here.
Thank you. And then this next question I have is for Jasmine, Rashad, and then Cory in that order. The question that folks were asking was, so what's the best way to bring together assembled data in a way that can be usable, whether it's being used by physicians? Recognizing we have Daniel, but we're going to ask you in terms of what could be the best way to deliver this information, either for physicians, first responders, or users of the communities. What's the best way to make sure it's tailored for the needs of the community with COVID-19?
So this is a tough one, certainly, just because there's so many facets that you need to surface from the data. For example, we ran a hackathon this past weekend, but a key part is we made sure that public health was involved. So it partnered with APHA, partnered with ASTO. Both are organizations that essentially serve the public health agencies and communications. And that's really, really important when you're trying to work on a project. We really need something to be multidisciplinary at this point. Again, back to Dean's point earlier, we're seeing lots of armchair epidemiologists with all kinds of maps and all kinds of machine learning models, but there's not a sense of what's grounded in reality and how that might work for different geographies.
Excellent. And thank you. And then Rashad, if you could share your views.
Yeah, I think that one of the things that we're starting to see, if people really want to engage, is that local level implementation of various types of actions is really starting to become more important. And so if you're curious, what is the way that I need to be thinking about my data? What is helpful and how do I make it available? It's probably in context of what are the variables that are important in your location, so whether it's California or New York or whatever it may be, and then trying to figure out how do I normalize for that population my data asset so that way it's usable by not the armchair epidemiologists, with all respect to the excitement, but the people who are actually the ones who are going to be making the decisions. Excellent.
Thank you. And then Cory, if you can bring it home for us, that would be great.
I just love the term armchair epidemiologist. I'm going to say that over and over again. So one of the things that we're trying to keep in mind, we're not necessarily a consumer-facing product, so we're not focusing on the lay user, that's out there in the world. We're focusing on some of the decision makers that are out there on the front lines, whether it's public health officials or first responders or things like that. So what we've been trying to focus on is really digging in deep with them, because we don't have the subject matter expertise. So, we shouldn't be armchair epidemiologists or first responders or any of those things. And so what we're trying to do is be user-centric in the way that we're doing it. We're aggregating data and trying to connect the dots between the data sources that they find the most useful. And we're just listening to them. We're doing a whole lot of listening to make sure that we understand exactly what it is that their needs are. Not their needs downstream, their needs today, tomorrow, and the day after, so that we can get the tools in their hands that they really need and will honestly make a difference. Because the one thing that a lot of us need to keep in mind as we're going through these exercises, like hackathons are great, they're great for community engagement, but we're talking about lives right now. And so we need to try to make sure that we get those tools out there and we have the ability to get them to the folks that need them now.
Excellent. Well, I want to thank all our panelists. I also want to thank Public Democracy and Skoll for helping work with the Atlantic Council to bring this together. I think this was a very important conversation. I feel like we did like an ultra concentrated hour, when in fact we could probably easily gone much more. And so maybe we'll do additional discussions together. But again, a big thank you to all the panelists, as well as to the questions that were asked by the participants in the audience. We will make sure this is available online for replays. And thank you again for all you're doing as positive change agents. We need you to help illuminate the way forward. The only way we will get through COVID-19 is to get through it together. And thank you for being that force. Thanks very much.
Thank you all.